Patients with advanced skin cancer in Australia now have access to a new treatment. From today, the immune-based drug Keytruda is listed on the Pharmaceutical Benefits Scheme. For people with melanoma, it's been described as revolutionary. For more on this, I'm joined in the studio by Melanoma Patients Australia's CEO, Hayley Andersen, and, as you're seeing there, Kathy Gardiner, who has melanoma. We've got that mixed up, I'm afraid. Kathy, let's start off with you. You were part of the trial, the clinical trial of Keytruda. What was your experience with it? You had melanoma. What happened?
I still have melanoma. I received compassionate grounds access to Keytruda, and it's been beneficial for me. I've been seeing increasing response to the drug, and I've had very little side effects.
How serious was your condition before you started to take it?
I have advanced unresectable metastatic melanoma, so essentially a terminal diagnosis. I had to wait for about a month and a half until I could gain access to Keytruda. So there was a bit of a limbo period there for a while.
And how long did it take before you started to see an improvement?
We saw improvements from the very first scan.
It must have felt like a miracle to you.
Yeah, it was.
And what's your prognosis now?
I still have melanoma and I still will have melanoma. But at the moment, I have only one tumour remaining, which is wonderful from the results that I had when I was initially diagnosed.
Continue to take the drug, it's ongoing?
Yes.
Okay, Hayley, if I can turn to you now. This seems to be a wonder drug, is it?
It's certainly a fantastic step forward. There's clinicians that describe it as a penicillin moment. And that there's definitely hope that in the future melanoma will be a chronic disease rather than a terminal diagnosis.
Was it a battle to get it onto the PBS?
Look, we're very excited that it is on the PBS, and it feels like it has been a long process, but in comparison, that process has been quite swift.
Okay, let's talk about cost then, Hayley. Before it was listed on the PBS, how much did Keytruda cost, and how much does it cost a patient now?
Yeah, per treatment, before the PBS listing, before today, it was somewhere between 10 and 12,000, and treatment is every 3 weeks. With the PBS co-payment now, it's under $40 for patients, and those with a healthcare card or pensioners, it's under $6.
So it's a huge reduction.
It's a huge shift, and has made it affordable and an option for all Australians that are affected by melanoma.
How many people will need it?
More than 1,000 patients will access this treatment each year. 12,500 patients are diagnosed with melanoma each year, and 1,500 die. So somewhere in the vicinity of 1,000 will require this treatment for their metastatic melanoma.
Yeah. Does it work for everybody?
The clinical trial results show that somewhere between 30 and 40% will have the dramatic response that Kathy's had. Another 30 to 40% will have a great result as well. There'll be tumour shrinkage, and perhaps not to the extent of Kathy. But there's still some work for cancer research. To ensure that everyone gets a good result.
But this will make a considerable difference to survival rates from
It's a huge difference.
melanoma.
It's a huge difference, and really we're very excited that patients can access it.
And Kathy, you're now a campaigner for sun protection. Do you think the message is getting through about that here?
I think there's always room for improvement with getting sun protection messages across, but I think with today's day and age, with social media, we have more tools at our aid to make people more aware about the problems that we face.
Kathy Gardiner, great to hear your story, and Hayley Andersen, thank you both for coming in today.
Thank you.